My name is Ivan Magana and I'm an intake specialist here at Rogers Behavioral Health. As an intake specialist, my primary responsibilities are answering phone calls, not only to patients and parents, but to the treatment team such as doctors, nurses, and therapists, but then also working on scheduling patients that could come in and to join the program, to be a part of their program. On the residential side of admissions, my job is to fill the beds for my programs. Sometimes it can happen in advance where I can schedule people to come in a few weeks, a few days prior to their admission, versus the inpatient side, which differs. These intake specialists are working on same-day admissions or people who are in crisis. Usually I'm on the computer the majority of the day, just responding to emails, looking at my bed boards. A bed board is an Excel sheet that has patients who are currently in or patients who I'm currently looking to fill those spots to come in. I have 3 programs: the Nashotah program, DBT, all-female adolescent program, the Focus Depression Recovery adolescent program, and the trauma program. So my job is to schedule patients to come in for all 3 of those programs. We also talk a lot here through Microsoft Teams, so I can talk to any of my coworkers, my manager on there. So I'm usually on the computer a lot during the day.
Rogers Behavioral Health, this is Ivan speaking.
When I started here, it took a little while just to get comfortable with the position. You have to understand all the different aspects. You have to go through a few weeks of training.
Rogers Behavioral Health.
I would say there is a little bit of stress that comes with this job. You can have your plan for the day, but that can all change in any second. You might be focusing on trying to work and schedule people to come in, and out of nowhere you get a phone call, and you're on this phone call for about like 30 minutes or so. That can be very stressful. You're also dealing with a lot of emails and you're responding to a lot of emails. The good news is that if things get overwhelming, we have supervisors, you have coworkers around to help you answer any questions, and our manager is really good here.
So come help me real quick over here.
Yeah, sure.
I found in order to be successful in this role, one has to have a few different skills, such as time management and organization. I would also say communication is definitely a skill that one needs to have. Time management, you need to know how to use your time wisely. And when it comes with the stressful things that come with this job, being organized is going to help you stay on top of things. This position is very rewarding because I get to develop relationships with not just my coworkers, but a lot of the different treatment team members such as doctors, nurses, and therapists. And I also really enjoy this job because I am the first person that people get in contact with before coming to Rogers. So I'm building relationships with them and kind of the start of their amazing journey here at Rogers.